Good day, everyone. I am Michelle, the embryologist for Sabacare Fertility Center. Welcome and thank you for joining us in our first ever online forum. I hope this opens up more ways for us to reach out to people in need and spread fertility awareness. Please stay with us and feel free to write in any questions you have in mind, either through live comment or private messages. We will answer it after the second talk. Today, we have two topics. Topic 1 is on myth and facts of infertility and when you should see a doctor by Dato Dr. Hatta, our visiting consultant, obstetrician, gynecologist, and fertility specialist. Welcome, Dr. Hatta.
Thank you very much, Michelle. Hello, everyone. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Good morning. How is everybody? Now we are in the fasting month of Ramadan, and I like to wish all our Muslim brothers and sisters happy Ramadan. Now my talk will be on the myth and facts of infertility. I would hopefully spend about 15 minutes for this talk, and my talk will be both in English and a little bit of Malay. So what are myths and what are facts? In other words, apakah itu mitos dan apa fakta mengenai ketidaksuburan? As you know, during sexual intercourse, the semen or the sperm is felt into the vagina. It drops into the vagina, and the spermatozoa then swims into the uterus, goes into one of the fallopian tubes, and will meet the egg at the end of the tube. This is where fertilization occurs. Once fertilization occurs, whereby a single sperm enters the egg, formation of embryo happens. The embryo will then divide from 2 cells to 4 cells to 8 cells and so on, and will travel back from the end of the tube, the fallopian tube, back to the uterus and gets implanted. This journey usually takes about 6 to 7 days. So apabila air mani itu masuk ke dalam rahim, akan berlaku persenyawaan pada hujung ataupun pada hujung fallopian tube atau tube fallopian. Dia boleh berlaku di kedua-dua belah ya. Apabila telur itu yang selalunya akan menunggu di hujung fallopian tube ini disenyawakan, akan terhasillah apa yang dipanggil embrio, dan embrio kemudiannya akan ditolak balik ke dalam rahim dan ditanam. Proses ini mengambil masa lebih kurang 6 hingga 7 hari. So what is infertility? Apakah itu ketidaksuburan? There are many definitions from many societies around the world. However, in a nutshell, infertility is the inability for one couple to conceive after unprotected sexual intercourse, or in other words, been trying to get pregnant for after 12 months or a year. This is when you do not have any other pathological condition. You do not have any diseases. Everything else is normal. So in other words, if you've been trying for the past 12 months but fail to get yourself pregnant, and then you need to seek help from the fertility specialist. So kalau kita sudah cuba untuk 12 bulan, untuk setahun, tapi gagal lagi untuk mengandung, datanglah berjumpa dengan pakar kesuburan untuk mendapat rawatan dan nasihat. If we look at the sperm or the semen of the husband, it usually it appears whitish in color. But more importantly, what we, the specialists of fertility, look at is the amount or number of sperm in the semen. This cannot be seen by the naked eye. Therefore, we need to look under the microscope. what we do is we count the number of spermatozoa, this one here is called spermatozoa, in 1 milliliter of semen. So it should be more than 15 million. We also look at the motility, atau dipanggil pergerakan. It should be motile and forward moving. And the other thing that we look at is the morphology or the shape and sizes of the sperm. It should be normal within 4 to 5%. If you have abnormality of the sperm, and it's a lot, then you may have a problem. If the motility is very low, there is a problem for the sperm to reach the egg. And if your count is very low, it's almost impossible for any of the sperm to be to be disseminated into the egg. So what are the causes of infertility? We can safely divide it into 4 causes, either due to the female or the wife, usually constitute about 30%. 30% may be due to the husband or the male. 30% could be due to combination of both male and female, and about 10% could be unexplained. That means we do not know what's the cause. Everything else is normal, the sperm is normal, the egg is normal. Unfortunately, you still can't get pregnant. So what are the factors that may influence your fertility? These are the facts. Obesity. Being obese is one of the factors that can make you a bit more difficult to get pregnant, because studies have been shown that obesity in the female can lead to higher chance of miscarriage, decrease in implantation of the embryo, as well as poor quality eggs. And in male, it may be associated with other diseases like diabetes mellitus, abnormality of the sperm, as well as increase the temperature of the testis. This may contribute to decrease in the number of spermatozoa. The good thing about obesity is it's reversible. That means if you can bring your weight down to the normal BMI range, you should be okay, right? You can get pregnant. Another problem is age. This is also a fact. We have seen that if you are older, especially above the age of 36, the ability for you to get pregnant spontaneously decreases, right? If you look at this graph, those below 35, the chances are higher. And those around 40 to 42, it is much lower. So, in other words, do not wait. If you've been trying for a year, but you still can't conceive, please do not wait. There is another definition to infertility when it comes to age. It is said that if you do get married late, for instance, or only been trying to get pregnant after the age of 35, if you've been trying for the past 6 months, not 1 year, 6 months, and failed to get pregnant, please come and see the doctor. So this definition of infertility differs if your age is more than 35, you've been trying for 6 months and failed to get pregnant, so please come and see the doctor. Age also contributes to other problems. For instance, miscarriage rate are higher if the woman is older. Birth defects also higher. Birth defects such as the Down syndrome increases. There's also a chance of you to get pregnant even though with IVF also decreases if you are older. There is a way that we can see whether your ability to get pregnant, or rather your fertility rate, is good, low, or high, is by doing a blood test called the anti-Mullerian hormone blood test. This can give us an idea on whether you are within the normal range or within the lower range of getting good quality, a good number of eggs. Another fact of infertility is people with multiple sexual partners. they may have run a risk of developing or contracting diseases or infection at the female genital area or the male genital area. The commonest are, for instance, chlamydia, hepatitis B, or even HIV. If chlamydia happens, what happens to your organs system is that the body will fight the bacteria off. However, it may lead to formation of scars, and this scarring can lead to blockage of your tubes and causes adhesions as well as difficulty for the sperm to reach to the end of the tube for it to fertilize with the egg. Psychological problems or effects. Psychological problems may also affect your ability to get pregnant. There are studies to show that psychological stress may impact the density of the sperm and the sperm's concentration. And for the female, stress, especially of prolonged stress of more than 32 hours at a week or longer, may be associated with other conditions like anxiety and depression and reduced fertilization. This is definitely a fact. Cigarette smoking. They said that there's about 4,000 type of toxin or chemicals in the cigarette smoke, and many studies have shown that if you are smoking, be it the husband or the wife, male or female, it decreases the ability for you to get pregnant. Right? It decreases the ability of you to get pregnant. One study shows that if a lady smokes more than 10 smokes a day, it can decrease the implantation rate. It can lead to more ectopic pregnancy and miscarriages. Vape is also associated with decrease in sperm quality as well as may decrease the ovulation function of the eggs. Certain uses of illegal drugs may also cause problem with fertility, and also excessive intake of alcohol. It is said that heavy drinkers in male is associated with a condition called oligozoospermia, which is decrease in the number of sperm, or teratozoospermia, which is decrease in the motility of the sperm. In the female, in the woman, it decreases the implantation rate and increases the chance of you to get miscarriage. Caffeine has been associated with um, inability to get pregnant, but in a large amount. If you take more than 500 milligrams per day, it can be associated with miscarriages as well as difficulty to get pregnant. A little bit of caffeine is okay, but too much is not advisable. Clothing, especially in men, it increases the scrotal temperature. The scrotum is where the spermatozoa or the sperm is formed. It needs a good temperature of lesser than the body temperature, around 35 degrees Celsius, to produce the sperm. If you wear tight clothes, it may increase the temperature of the sperm and decreases the chance of getting good motile sperm. It is also said that taking long hot bath or warm jacuzzi or saunas may be associated with decrease in the sperm motility as well as the count of the sperm in men. So try to avoid it if you have a problem. So in conclusion, all this, if you are overweight, always get your weight down. It's advisable because not only that it will prevent, it will increase your chance to get pregnant, it also prevent you from getting other diseases during pregnancy. Do go for regular exercise to control your weight, as well as exercise has been shown to reduce stress. Avoid things like alcohol, illicit drugs, and things like multiple sexual partners. Wear loose clothes and lead a healthy lifestyle. So this is my last slide. Don't wait until it's too late. As you know, age is also a factor for infertility. So please get your advice from the specialist as soon as possible, especially if you've been trying for a while to get pregnant. Thank you. So that's the end of my talk. Now I would like to pass the mic back to Michelle.
Thank you, Dr. Hatta, for the informative and interesting talk. Let us proceed to the second topic of the day, making pregnancy possible with assisted reproductive therapies by Dr. Tsing, our clinical director and resident consultant obstetrician, gynecologist, and fertility specialist. Welcome, Dr. Cheong.
Thank you, Michelle. Welcome, everyone. I'm Dr. Cheong. I'm going to talk to you today on treatment options for ART, which stands for Assisted Reproductive Techniques. We will discuss these three options of fertility treatments: ovulation induction, IUI, IVF, and ICSI. The last part of the talk, I will touch briefly on pre-implantation genetic testing and our freezing and donation services. Let's start with ovulation induction. Ovulation induction is a treatment that helps you to ovulate. An important message I always like to convey is that we must know what problems the couple is facing so that we can select the most suitable treatment for them. So who is suitable for ovulation induction? A simple clue is to look at your menstrual history. If you have a very regular 28-day cycle, ovulation induction doesn't help you much because you can ovulate normally. But if for somebody whose period comes every 3 months, 6 months, or even once a year, then yes, ovulation induction can help you to get pregnant by helping you to ovulate normally. I know some patients that will buy their ovulatory drugs over the counter and take on their own, but this is not really recommended. We should monitor you by doing transvaginal ultrasound scan. You can see here, these are called follicles. They are fluid-filled structure with an egg inside. And this is what we want to see. This follicle has grown to size like this, and we know the egg is about to be released and you are about to ovulate. So by doing transvaginal scan, not only we can tell whether you respond or not, we can also determine exactly when you are going to ovulate. This is how a transvaginal scans look like, and this is what we want to achieve. What are the choices of ovulatory drugs? Clomiphene citrate or Clomid is very commonly used. It is relatively cheap, simple to use. You take for 5 days during the early part of your period, and many women get pregnant with this simple method alone. But not everyone is suitable for Clomid because it has a side effect, which is making the uterus lining thin. That's why it's important for us to monitor you with transvaginal scan, because we want to monitor your response. At the same time, we can also measure the thickness of your uterus lining. If your lining is thick, then very good. But if you have a thin lining, which means Clomid is not suitable for you because embryo don't implant well with a thin lining. So if it's not suitable for you, then you shouldn't keep taking Clomid repeatedly. Apart from Clomid, we also use Femara, which is also an oral tablet taken in a similar way as Clomid, also for 5 days during the early part of your period. If both Clomid and Femara don't work for you, and we can move on to FSH injections. FSH has a higher pregnancy rate than Clomid or Femara because it doesn't have the problem of thin lining. But because it's a stronger drug, so we must monitor you. Otherwise, we may end up like this, too many eggs, which can be very scary. This is how we give the injection into the tummy fat. It's very easy. I can say almost all my patients can do it themselves after training. We must also educate our patients how to maximize their chance of success. An important aspect is to maintain a normal weight. Both underweight and overweight are not good. By weight loss alone, it increases your chance to get pregnant spontaneously, naturally, without treatment. Even if you are going under treatment, weight loss can help to improve your response to the ovulatory drugs. Next, IUI or intrauterine insemination, 宫内受精. IUI is a very simple outpatient procedure whereby we inseminate the washed sperms into the uterus cavity. Washed sperms means the sperms have been washed for us to select the most active sperms. And you can see here, the sperms still have to swim inside the fallopian tube and look for the egg. And that's why you must have healthy sperms and healthy tubes for you to be suitable to go for IUI. As mentioned before, it's very important to know the right indication. So who is suitable for IUI? Unexplained infertility, where both husband and wife are healthy, no problems with the sperms, and no problem with the tubes. Mild sperm factor is still suitable to go for IUI, but not for severe sperm factor. Mild endometriosis, yes, or after a patient has undergone ovulation induction but failed, yes, they can move on to do IUI. Next, IVF and ICSI. This is the father of IVF, Sir Robert Edwards, who invented IVF. The first IVF baby, Louis Brown, was born in 1978, and since then, we have now more than 8 million IVF babies born. IVF, or more commonly called test tube baby, bayi tabung uji, 试管婴儿. In IVF, a woman has to undergo hormone injections to help them to produce many eggs. After that, we will do a procedure called egg collection. After that, the eggs will be fertilized by the sperm in the lab. If you ask me what is the difference between IVF and ICSI, for someone who is going through the treatment, I would say no difference, because the difference only lies in the lab. If the sperm is healthy, yes, IVF is suitable. What we do, we will place one egg and put in a small plate like this, and we'll put a lot of sperms next to it, and we'll let the sperm fertilizes the egg on its own. But if there is a sperm problem, for example, very low in number, then we have to help the sperm by selecting one sperm and inject it directly into the egg. This is called ICSI, or intracytoplasmic sperm injection. After the embryo is developed, we will put it back into the uterus. This is called embryo transfer. It is done under ultrasound guidance without anesthesia. But egg collection is normally done with some mild sedation in the operating room. Kita menjalankan procedure pengambilan telur dengan ubat bius yang ringan, tetapi embryo transfer boleh dijalankan tanpa ubat bius. Again, important for us to know the right indication. So if you have severe sperm problems and both tubes are blocked, then you need to go for IVF, and don't waste time in going for other treatments. IVF is also recommended for older ladies or when a couple has married for many years because they have no extra time to lose. That's why we have to go straight for IVF, which gives the highest success rate compared to other treatments. This is a very important slide. And you can see here, the older the woman, the lower the pregnancy rate. IVF gives an average success rate of about 30 to 40%. At the age of 35, it starts to come down. At the age of 40, it is around 15 to 20%, and it continues to drop further, and it's almost 0% at the age of 45. That's why it is very important not to delay treatment. Jangan tangguhkan rawatan sebab semakin tua wanita, semakin rendah peratusannya. 我们鼓励你们不要太迟求医，要尽早见医生，不要错过你们的黄金时期。Next, pre-implantation genetic testing or PGT. Some patients may ask, is IVF baby confirmed normal? The answer is no, but there is a way to check it. These are how embryos look like. This is a day 2 4-cell embryo, a day 3 8-cell embryo, and a day 5 embryo with many cells. Pre-implantation genetic testing means before implantation, before embryo transfer, we can biopsy the embryo cell and analyze the DNA. This is a cell, and all our DNA material is coiled up in this structure called chromosome, and one tiny section of the chromosome is called a gene, and there are many genes on each chromosome. PGT can help us to diagnose abnormal chromosome and abnormal gene. Example of abnormal chromosome is Down syndrome, when they have 47 chromosomes. As we know, a healthy person should only have 46. One extra or one less will make it abnormal. Example of abnormal gene is thalassemia gene. Thalassemia is very common in Sabah. If a couple, say both husband and wife are thalassemia carriers, they will be afraid of getting a baby with thalassemia major. So PGT can help them to select a normal embryo without the thalassemia gene. And we know the older the lady, the higher the risk of having an abnormal baby because of our poorer egg quality. You can see here, at the age of 40, up to 65% of our embryos can be abnormal. This is quite high. It's even higher when the age is 42 and above. 80% of the embryos can be abnormal. That's why PGT is recommended for older ladies because it can help us to select a normal embryo to transfer. PGT is also recommended for recurrent IVF failures. These ladies has had many IVF treatments, but each time the embryo just doesn't want to implant. And we know abnormal embryos don't implant well. Again, PGT can help to select a normal embryo to transfer, thereby increasing their chance of success. So PGT for who? For advanced maternal age, recurrent IVF failures. It is also recommended for recurrent miscarriages. And we know in miscarriage, more than half of the time is due to abnormal embryos. That's why PGT can help to select normal embryo to transfer, thereby improving their chance of having a successful pregnancy. And since we know which embryos are normal, we won't be wasting time in putting back the abnormal embryos. That's why the aim for PGT is also to shorten the time to pregnancy with a normal embryo. Next, cryopreservation or freezing. Yes, our center does offer freezing services. Kita juga ada rawatan perkhidmatan pembekuan sperma, telur, dan embryo. This is how we store them at a low temperature of minus 196 degrees Celsius in the liquid nitrogen tank. We also provide freezing services for our cancer patients because cancer treatments such as chemotherapy and radiotherapy can lead to testicular failure and ovarian failure. So before they go for their cancer treatments, we can help them to freeze their sperms and freeze their eggs, and this can be used in future fertility treatments once they've recovered. Finally, donation. This can be egg donation or sperm donation. For egg donation, the commonest indication is for age factor. For example, when the woman is 45 years old and above, because at this age the egg quality is poor and this gives a low pregnancy rate. Another indication is premature ovarian failure or premature menopause, when the ovaries have stopped producing eggs. It is also indicated for poor responders. These ladies can produce eggs, but previous IVF treatments have shown that their eggs are very few in number and of poor quality. So egg donation can help to improve their chances. Sperm donation is indicated for azoospermic men when there is no sperms found in the seminal fluid due to testicular failure. So in conclusion, it is important for us to know the right indication so that we can select the most suitable treatment for you. And how to maximize your chance of success? Have a healthy lifestyle. With regular exercise, keep a normal weight, and always have a positive attitude. And most important of all, don't delay treatment. Last but not least, I would always like to show this slide to encourage my patients. Don't give up. Even if you fail on your first attempt, please do not give up, because it will improve when you try again. With that, I'm going to end my presentation here. Thank you very much for listening. Now we will move on to the Q&A sessions.
Thank you, Dr. Cheong. Hello again, I'm Dr. Hatta. I have a few questions here. There's one question here that asked, what about women? Do tight clothes affect fertility in the women? Actually, tight clothes do affect fertility in men, but when it comes to women, there are no studies to show that tight clothing is any effect to the fertility. Why tight clothing affect the male more is because of the heat. When you wear tight clothes, the scrotum is usually placed very close to the body, and this increases the temperature of the scrotum. Disebabkan oleh scrotum tu dekat dan rapat dengan badan lelaki tu, temperature badan kita 37 darjah Celsius. Dan kita tahu kita perlukan temperature yang lebih rendah dari 37 darjah Celsius untuk menghasilkan sperma yang bagus. Jadi kalau skrotum tu terlalu rapat dengan body, ia akan menyebabkan suhu di skrotum itu meningkat. And this will have an effect on the spermatozoa formation. Another question is BMI. If my BMI is 33, can I go for IVF? Kalau BMI saya 33, bolehkah saya membuat rawatan IVF? Jawapan dia ya. Tetapi, kalau kita dapat mengurangkan BMI kita ke paras 29 atau lebih rendah daripada itu lebih baik untuk menjaminkan IVF kita lebih terhasil, lebih successful. Macam saya katakan tadi, obesity atau kegemukan tu boleh menyebabkan banyak masalah. Walaupun dengan IVF, kita dapati kebanyakan daripada pasien kita yang mempunyai BMI yang tinggi, IVF dia bukan selalunya berjaya. Maka memang kita galakkan turunkan berat badan dulu sebelum membuat rawatan IVF. I have another question here. Will there be any difference in getting specialist treatment in government hospital or private hospital? There are no difference actually. They're still the same. The specialists of both government and private hospitals are usually the same. Kepakaran dia sama ya. So may not be the same person, but the same speciality. So there are no difference for you getting any treatment from anywhere in the Malaysian government hospital or the private hospitals. However, private hospitals may have extra services, which I think Dr. Cheong would like to explain further after this. So I would like to pass the microphone back to Dr. Cheong for her Q&A.
Hello again, I'm Dr. Cheong. I have a question here. Please explain PCOS when they're trying to get pregnant. Very good question because PCOS is a very common condition. PCOS stands for polycystic ovarian syndrome. If I want to explain simply, we can say these ladies have some hormonal imbalance. On one hand, they have many follicles, but then the follicles refuse to grow. If you remember one of the slides I show you, we want the follicle to grow to a nice big size, then the egg can be released. So these ladies, they often have irregular periods, and very often they don't ovulate because, like I say, the follicles don't grow. We can say that they are a bit lazy, just staying small size, sleeping all the time. And some PCOS lady are also obese, so we also have to address the weight issues. But one good thing I want to tell ladies with PCOS is that you have very good chance in getting pregnant because, like I say, we need to know the right indication. These ladies, we can say we know the exact cause of your problem. You can't ovulate. So sometimes with the simple treatment of ovulation induction alone, you can get pregnant successfully and in an easier way. But because of the obesity that is often seen in PCOS ladies, so I always tell my patients, yes, we can help you to ovulate with all our ovulatory drugs, but there are two other things we can consider to improve your chance of success. And number one is to keep a normal weight. And the other one is to use metformin. So if we add in this drug called metformin, it also improves your response to the ovulatory drugs. So PCOS lady, no problem. We can get you pregnant quite easily. Next question. May I know about low progesterone? What should they do? This is quite a tricky thing to answer because it is not easy for us to diagnose a problem based on progesterone itself. Usually, we still have to look at the whole picture, whether it is the egg problem, the sperm problem, or the tube problem. So again, if I want to answer this simply, we don't have to worry too much about low progesterone. We still have to find the exact cause of the infertility. Then once you get pregnant, in certain cases may need progesterone support to help you to maintain the pregnancy. Otherwise, at this point in time, you shouldn't be too worried about this low progesterone issue. Another question here, klinik buka ke semasa PKP ini? Yes, we are open, but because we still want to adhere strictly to the social distancing, that's why we are spacing out our appointments in order we don't crowd the clinic. But later on, we will show, I think on the screen, yeah, you can see our WhatsApp number. Please WhatsApp our nurse and then we can advise you on the clinic appointments. We have a last question here. Is it possible to get pregnant even with a fibroid? Again, very good question. Fibroid is so common. Yes, definitely the answer is yes. And I'll move on to the next question, meaning to say, do we need to remove the fibroid? The answer is yes and no. Some fibroid, especially those small in size and their location in the uterus, doesn't affect the uterus lining, which means it doesn't affect implantation of the embryo. We can leave it alone. But sometimes when the embryos are big or unfortunately the location has distorted, meaning kacau, the uterus cavity, then we have to remove the fibroid. But yes, I do have many ladies with fibroid. They do get pregnant successfully. So yes, definitely possible. Right, so this is the final question. Kalau mau buat IUI, berapa lama ambil masa untuk treatment? It varies. Actually, it varies between patients, but let's say I give you examples of two scenarios. If a patient has regular period, for example, 28, 30-day cycle, we know that they are very likely to ovulate on day 14, 15, meaning they are mid-cycle, because we do IUI on the day of ovulation. So we can say it takes about 2 weeks before we can do the IUI. But for if somebody whose period is very irregular, then the timing is a little bit uncertain because we need to regularly scan you to determine the time of ovulation. Maybe I'll share one example. I have a lady whose period comes only once in a year. So she has problem with ovulation and we needed to use injection because oral form of treatment doesn't work on her. And one piece of advice I always give to my patients like this is we have to be very patient. And this lady ends up having to inject for 28 days before she has a nice follicle, which means we end up doing the IUI on day 28 of a period. Unfortunately, she gets pregnant on the first attempt. So the timing does vary. So I think this is our last question. Thank you very much for joining. I hope you all find this useful. So we're going to conclude the session now, and I'm going to invite back Michelle to close the session.
Thank you, Dr. Cheong. We are so sorry that we couldn't answer each question individually due to time restriction, but please do not hesitate to drop us a message in WhatsApp 018-778-0185 or Facebook private message. We will attend to your queries later. Lastly, following our first Facebook Live, our center will have more upcoming online events, so please follow our Facebook page and stay tuned for our announcements. We wish you good health and stay safe. Have a nice day.